Hello, thank you very much for the opportunity to speak, panel members and sages. I'd like to thank my partner, Dr. McCormick, Mr. Kawabe, and Dr. Kobayashi from Tokyo for the opportunity to speak about the Eureka Artificial Intelligence System that allows for real-time color-coded tissue identification in minimally invasive laparoscopic and robotic surgery. These are my disclosures. So what is Eureka? Eureka is the surgical future today. Here's an operation by Dr. Kondo where he's doing a rectal cancer dissection. You can see how he enters the presacral space at the sacral promontory, and you can seamlessly see how the Eureka Artificial Intelligence System readily identifies the connective tissue highlighted in turquoise for him to dissect. It also identifies the nerves highlighted in green for him to protect those and avoid those. It is a seamless integration of his actual surgery with the AI Eureka system. Whether he's zooming in, zooming out, changing quadrants or locations, it immediately identifies the tissue that he wants to identify, protect, or dissect. It allows for increased precision, safety, and efficiency throughout his operation. What is Eureka? It's the brainchild from Dr. Kobayashi, a board-certified Japanese surgeon, who realized that artificial intelligence had implemented itself in many aspects of our life, but not yet in surgical care. So he started developing this system in 2017, eventually introducing the Eureka system in 2021. It is a very complex, highly technical AI device doing multiple aspects of highly dimensional variables that you can't do with normal computing, and it allows to identify complex anatomic structures as well as microstructures. What is Eureka? It is a portable AI unit. It's 10 kilograms, 70 centimeters in size, and can transport to any operating room that you have and can connect to any laparoscopic or robotic system that you have. Very simple. You take your input, one wire connected to the Eureka device, one wire connected to your monitor, and voila, you've got artificial intelligence in your minimally invasive theater. It allows for color-coded identification of multiple tissues. When you plug the unit in, you simply select the tissues that you want, the colors that you prefer, and you get to operating. It's also a 2K video recorder as well as storage device. So you can use this for training and storage and evaluation of your own videos. What is it really? Eureka is the world's best teacher. I had the opportunity a few years ago to go to Tokyo and speak at the Japanese Color Proctology Society, where I was blown away by Dr. Imanishi's description of the Eureka and his training. At the time, the Eureka system was only part of the educational and research form used in Japan. Fortunately, they have just recently received certification to be used clinically throughout Japan. There have been multiple studies showing the benefits of artificial intelligence, and specifically the Eureka system, its potential in learning and education throughout the world, in very good articles. And I realized as the head of our robotic education curriculum, I had to get them to Pittsburgh to try to get them implemented into our teaching program to learn about this device and use it. Here we are connecting the device to the Da Vinci system, simply plugging it into the unit and plugging it into the slave monitor. This is my senior partner, Dr. McCormick, performing a single-site robotic ileostomy takedown. Here we are in the operating room, the typical tower that you see with the Da Vinci. Behind the tower, you can see just the corner of the Eureka system. Again, highlighting how small this system is, how easily portable. It doesn't take up any more space in our very tight operating rooms. This is the typical screen that you see as you're trying to instruct to your residents and your fellows where to go, what to see, and how to do. And here's the Eureka system, showing everybody in the room, the scrubs tech, all the way to your fellows, the immediate feedback of what's going on in the operating room. When we sort of highlight the opportunities that you have with the Eureka system, more than just colors, we can do a steady view, you can do pulsating view, and you can see how it's not very distracting. This is a very complicated operation. Dr. McCormick's a master surgeon. He can identify the planes, but it's hard to describe that to other people when they're not embryologic planes that they're used to seeing, where to cut, how to navigate through the difficulty of such a complex operation. And then we're able to do that seamlessly with our system. But it's not just robotic. Here's Dr. Yu performing a complex rectal cancer operation laparoscopically. Again, he's entering at the sacral promontory, seeing the connective tissues to dissect to get into the presacral space. Here again are the nerves that are identified to protect and avoid. Here he is entering the top of the holy plane, and you can see the critical view of this aspect is to identify those hypogastric nerves, which are readily apparent with the Eureka system. And as he's dissecting over to the left side of the pelvic wall, you can see the ureter is readily identified very quickly and efficiently. He's got ICG in place like many of us use. Having the AI system allows you to avoid having a urologist, stents, ICGs, or anything. It's readily identified. It allows for a higher precision and safety and efficiency throughout the operation. So why is it important? Because all we ever really want is improved quality and improved efficiency. And we know because that leads to better clinical outcomes, faster recovery for patients, decreased morbidity and mortality. And we know that the important part of that too is decreased costs. Less operating room time, faster operations, less resources, faster recovery, and less readmissions. And we know that if we look at the NISQIP study with over 500,000 patients confirming the benefit of minimally invasive surgery in multiple aspects, appendectomy, colectomy, hysterectomy, and prostatectomy. So Dr. Kobayashi indeed has improved surgical care. Better teaching, better learning, better quality of surgery and efficiency, better patient outcomes, and decreased costs. The surgical future is today. The Eureka system provides that real-time color-coded identification. And I'd like to invite everybody to our booth at 3:15 to have Dr. Nato give a talk as well, booth 404. Thank you very much.